Welcome to the first lecture on data quality and information governance. The objectives for this presentation are to understand the different purposes of data, discuss the impact of poor data quality on quality measurement, and identify the attributes of data quality and key process recommendations. In today's information age, data are increasingly driving healthcare decision-making. Healthcare databases are filled with the data that reflect clinical and clinically related information. The data are usually collected through the routine processes and activities of patient care. However, its usefulness goes beyond the operational applications that generate the data. The documentation within the electronic health record is often used for quality improvement, payment, legal, research, and accreditation and licensing purposes. Quality aims such as eliminating duplicate or unnecessary tests or screening and implementing preventive strategies for identified safety risks can be achieved by ensuring complete data collection and an effective health information exchange. Reimbursement can be enhanced by providing the appropriate prompts to substantiate medical necessity. Malpractice cases can be more successfully defended if the content and quality of the record provides an accurate depiction of the events and jogs the memory of the provider. Research through public health and biosurveillance agencies can be facilitated if the data collected meet identified definitions and standards for data quality. And last but not least, accreditation and licensing decisions often rest on whether or not the organization's documentation substantiates the standards set forth by the agency. Data are more precious than ever as their use and application expand. It is important that a clear distinction is made regarding the use of data. When data are collected to improve care, the collection characteristics are different than when it is collected to advance research and expand our knowledge. When the aim of the data collection is to improve care, use observable data. You accept that there is a consistent bias and collect just enough data to make a decision regarding the outcome of the test in a small and sequential manner. When the aim of the data is to acquire new knowledge, on the other hand, data are better collected blinded, when neither the researcher nor the subject are aware of the test being performed. You attempt to eliminate biases when they exist and collect a wide variety of data points for a sample size determined through a power calculation. The National Quality Forum joined with HL7 AHIMA and the consulting firm Altshuler Associates to develop a draft standard called the Health Quality Measure Format, HQMF. HQMF was developed in part to support meaningful use, as described by the American Recovery and Reinvestment Act. The main goal of this format is to standardize data to have consistency across vendors and regions and thus support the meaningful use of health information technology. This standardization is accomplished through a number of domains such as document structure, for example, sections in documents, metadata, for example, having an author or a verifier, and definitions, for example, numerator or initial patient population. Although this standardization is an important first step, it does not enable full machine processing at this time. Quality and safety issues can often be linked back to poor documentation, inaccurate data, or insufficient communication between providers. Operationally, poor data quality leads to low satisfaction and increased cost. Even simple errors such as inaccurate or incorrect names, addresses, and insurance or benefit information can have a negative impact on the satisfaction of patients and staff alike. Patients have a right to expect that the details of their care are documented completely and correctly, and that the quality and safety of their care is not compromised by inaccurate or ambiguous data. Operational costs can be increased because of the unnecessary duplication of tests or procedures, inefficient care processes, or additional time and resources that must be directed toward detecting and correcting data problems. Strategically, poor data compromise individual and organizational decision-making. Good decisions require an effective synthesis of multiple bits of data that can be converted into meaningful information. Gaps in the data due to missing or incomplete detail or suspicious accuracy complicate the process of effective decision-making. Teams can also get diverted by deliberating the quality of the data and never get around to deliberating the decision at hand. Mistrust of data can spill over into mistrust of other team members and their motives. This can lead to duplicate data collection, resulting in further delays in analyses and effective decision-making. If decision-making is hindered, so is strategic planning, since it is a process that requires decision-making. It requires thoughtful assessment of strengths, weaknesses, opportunities, and threats, and depends on high-quality internal and external data. Once developed and implemented, the plan must be evaluated to determine its effectiveness. If the reported results are of poor quality, knowing how to modify the strategic plan is made even more difficult. Data quality problems have always persisted, sometimes to a larger degree in some data elements or processes than others. In the past, the important data were edited, or processes of data collection were corrected to ensure accuracy whenever the data were specifically identified as required for quality improvement or regulatory monitoring purposes. The other data elements were not deemed important for correction, as these were assumed to be unnecessary. As we move into a new era of health information technology, we are finding the new uses for the data and the accuracy and quality are increasingly important. For example, data within EHRs are increasingly used to detect errors. By applying queries, algorithms, and decision rules, we can identify cases that represent potential adverse events. In order for these tools to be effective, the data contained in the EHR has to be completely and consistently entered by healthcare providers. Data quality management must involve more than fixing problems after the data are entered. It involves preventing the issues from occurring. A fundamental shift to design with the end in mind requires the knowledge and skills of insightful clinical and IT professionals. The first step requires you to begin with quality data. A case study of data quality in medical registries published by Arts, DeKaiser, and Schaefer offers a good summary of many of the data quality issues previously presented in this module. In this article, they discuss common causes of insufficient data quality as either systematic or random. The systematic causes, or what is statistically referred to as type 1 errors, are those that can be attributed to some bias or flaw in the measurement process that is not due to chance. Systematic causes, if not corrected, will cause repeated flaws or errors with a predictable pattern or a high degree of uncertainty. Some frequent systematic causes of insufficient data quality are unclear or ambiguous definitions, incomplete or unsuitable format, violations in the collection, processing, or analysis, poor design in the tools or forms for data entry, and a lack of quality auditing or control processes. Random causes occur with less predictability and can include inaccurate transcription or typing, as in free text entries, sheer data overload and the possibility of ambiguity or selection of irrelevant data, inattention or poor understanding on the part of individuals completing the entry analysis, or data warehousing procedures. Health information technology solutions offer a number of opportunities to improve the quality of data. Standardization of terminology has multiple effects in the improvement of data quality. In their study, Thede and colleagues describe some of the benefits of standardization in the nursing field as including, better communication among healthcare providers, improved patient care, enhanced data collection to evaluate outcomes, greater adherence to standards of care, and facilitation of assessment of competency. Some advantages can be assigned to the use of standardized terminologies by other professionals. Another significant aspect of the improvement of data quality relies on the use of structured data fields. Structured data fields are fields that contain information that has a predefined data model. This allows the data to fit into relational tables, thus permitting the easy extraction into reports. The use of structured data fields is somewhat challenging, particularly for clinicians. During their training and their previous experience with paper charts, clinicians have used a narrative form to document the ailments of their patients. This storytelling format is difficult to translate into the more dry structured data format and requires some retraining for all clinicians. However, in the current electronic health records, There are areas where clinicians can document in free text or storytelling format and yet preserve the integrity of the documentation. Structured data fields can be accomplished through pick lists, check buttons, or radio buttons. Finally, there is another format of data capture based on voice recognition that will enable the user to capture more comprehensive data. However, the majority of this data capture, albeit comprehensive, happens in a free text format. Finally, there are options that, although not currently in wide use, can enhance the quality of data collected through an HIT solution. The use of natural language processing machines capable of learning can eventually prove a valuable tool to enhance quality of data. The use of biometric tools that enter the measurements directly into the electronic health record can be an additional tool for data quality improvement. Clinical data are increasingly used to drive healthcare decisions. The data that are captured to document patient care are also used for billing, risk management, accreditation, quality, and healthcare research. What is clear is that poor data quality can threaten patient safety and quality, decrease satisfaction, increase cost, and compromise strategic planning. Data quality is a complex, multidimensional concept, and a number of attributes should be considered at all phases of health information technology development and use. An HIT professional who is aware of the common systematic and/or random causes of data insufficiency can skillfully employ best practices in the areas of prevention, detection, and quality improvement to enhance the overall quality and usefulness of healthcare data. Thank you for listening to this presentation.